gives them an idea. They're still in the process of trying to figure out what they're going to do, so it gives them an idea of what a choice it is. So I am a paramedic full-time, so answering emergency phone calls is my full-time job. But today I am here to persuade you guys to try to look into try to go into the paramedic career field, okay? So 911 is the dreaded number that nobody wants to call, right? Because obviously if you're dialing 911, it's an emergency. So either somebody is in danger, it's emergent, they're not doing well. That is our go-to, and it should be, because we like to know that somebody out there is going to come and help us, correct? Okay. So whether it's a medical call, whether it's a fire call, and whether it's a wreck, they always send paramedics. In case there's a patient in a fire, obviously if you're taking a patient out of a car, and in a medical situation, they always send paramedics out there. And it is something that I've been doing and I love to do. You help people when they're at their scariest moments, when they're in need, in any scary situation. So today I'm going to tell you all the different things, all the cool things that you need to know about it's called paramedicine, but our title is paramedic. So they can work on an ambulance, we can work on helicopters, we can work on airplanes, we can work with fire departments, and most importantly, our military has combat medics. I currently have a daughter. She is a combat medic for the Navy. She is right now in Vietnam, and so it's been kind of neat to know that she's doing the exact same thing that I do. So just thought I'd throw that out there for a fun fact. Okay. So let's talk about all the different things that these different departments do. So obviously, as what paramedics do in general. So not only do we answer medical calls, right? But when we get there, we get a call from a dispatch that gives us a little description of what we're going out to, and that little description has to open your mind to what possible treatments we're going to do, what their possible problems are going to be. So obviously once we get there, we provide treatment for these patients, we provide advanced life support for these patients. We help them anywhere from, bandaging a small wound. We do intubations, which is typically putting a tube down someone's throat to help them breathe when they can't breathe on their own. We do that when they can't breathe on their own, and then we do that with medications. So you use medications for pain, you use medications to paralyze somebody if you need to, and all these things that we do are all under a medical director, which is a doctor. So a doctor watches everything that we do, and everything that we are allowed to do is based on his permission. So what he does is he gets this book, and it's called our protocols, which has everything that we need to do on there. And you have to follow that book because it's his license on the line. So anything that you do is, falls under him ultimately. So, one of the cool things is that I don't think people know is there are some medics, in an ambulance setting we do it, in a helicopter and airplanes. One of the things that people don't know is they do surgical cracothyromies. So it is a surgical airway in real case of a real emergency. So they go in and put a small incision and stick a tube down your throat because that's the only way that you're going to be able to breathe, and we're allowed to help someone stay alive that way. So like I said, whenever you work, you can work on different departments. But in an ambulance setting, what we do is we answer the calls, we go out, we treat, we can medicate, we can do anything, we can provide. The best thing about these things, about an ambulance, is we provide moral support. That is by far one of the best things that you can do, because somebody can call EMS for a stubbed toe, but as long as you tell them it's going to be okay, take a deep breath, anything, you can make anybody feel better with moral support of any kind. So in an ambulance, those are all the things that we can do. Helicopters are a little different. They usually require 2 to 5 years of experience, and they can land on a scene, so they can land in the middle of the street if you need them to. But we only do that. We only call them out if we have like a patient that's going to take too long to get out of a vehicle, that kind of thing. That's the only time we call a helicopter to land in the middle of the street or a road or a yard. Usually your airplanes, they are used for transporting people. Usually if we need to get somebody somewhere to with a faster time, if it's an emergency and we need to get them a lot quicker, then we use an airplane. And then most importantly, your combat medics. Your combat medics for me are by far the most important, because these are the medics that are out there treating your soldiers. You know what I mean? They're out there keeping our country safe, but our soldiers safe, and doing anything that they can on the field, and I think they have the hardest job because they treat under the worst circumstances. At least here, we make sure our scene is safe before we even go out there. But over there, you don't have a safe scene. You just go out there and treat what you can. So those are the different departments. Like I said, an ambulance, a helicopter, an airplane, and your combat medics. One of the coolest things I thought is it doesn't require a lot of schooling. So depending on what you guys think, it's a lot of schooling, but typically you get your EMT certification and it's all national registry, so it's known all nationwide, and that can be anywhere between 6 to 8 weeks or maybe even a semester. I took an advanced course and it was just a year long, but Howard College does have one that has, it is a 2-year paramedic program with an associate's degree, and so I think that's really neat. So I also think that if you guys look into National Registry for Paramedicine, they give you a ton of details on there on what you need, what the testing is like, all those other cool things. And then if you look at the Texas State Department of Health Services, they give you a lot of information on licensing and all those other things. So it's really neat. So if you guys want to look into a career that not only helps you help people in their scariest moments, their weakest moments, this is the career to go to, and it's very rewarding. It's the most rewarding thing because you are helping somebody with sometimes just telling them it's gonna be okay. You are the first person that they see, and so they will remember that. So that is all I have. So if you guys think about going to college for something else, I think paramedic is your way to go, okay?